everyone. I'm going to come on and do a social media unpack today. And the post that I read talked about abusers. Probably they use the word narcissist because that's what all the pop psychologists on social media use. That therapy doesn't help them, it actually makes them worse. Now, directly, that quote is actually accurate because these people are seeing therapists that aren't trained in abuse. 99% of therapists are not trained in abuse. Unless you're working specifically with children, then you may get some work with domestic abuse in that regard. But as far as this kind of abuse, intimate partner abuse, targeted partner abuse, no one is trained in this area in their graduate work. So the myth here is that abuse isn't correctable or it won't change. And absolutely, abusers can change. Absolutely, they can. There's no reason that they can't. They give themselves permission not to. So an abuser who's been doing a lot of therapy and who is getting worse is with a therapist who's condoning and enabling that abuse. An abuse specialist will not enable it. They will call it out. And someone who is interested in changing and want to change, so all you men out there who think that you're just this way and it was your mother that made you this way or your childhood or whatever, those are all myths and they are fallacies. They are not accurate. Abuse is a correctable, behavioral, permission-giving action that you give yourselves permission to do. You can stop it. You can begin to care about people. You can begin to take responsibility for your own behavior. You can begin to do the hard work of making all of those changes that you need to make to see other people, to consider their point of view. You don't always have to be right. You don't always have to be in power, and you don't always have to be in control. So if you are dealing with someone who uses targeted partner abuse and they are not getting the right kind of treatment and things are getting worse for you, come see us at Center for Peace, www.cenfp.org. We can help you understand what's good science, what's good therapy, and how to navigate this so that you can get to safety. Come see us.